Hello everyone, it's Sadiq Khan here, the Mayor of London. I'm proud to support efforts by the Council of Somali organisations to encourage everyone in the community to get the COVID-19 vaccine. The evidence shows that this pandemic is having a devastating and disproportionate impact on those from minority backgrounds. That's why it's so important that we're doing everything we can to protect ourselves, our loved ones, and our communities from this terrible virus. We know the vaccines are safe because they've been through exactly the same rigorous testing regime as any other vaccine, including the flu jab. We also know that they're effective at saving lives and that they're a route back to doing the things we miss and seeing the people we love. That's why when I was offered the vaccine, I happily accepted it. And the same is true of my mum, who I'm relieved to say has also been vaccinated. So please, when you're invited to receive the vaccine, join the millions of others in getting it, not only for your own sake, but for the benefit of everyone you care about.
The arrival and rollout of COVID-19 vaccines are being celebrated because they offer a way out of the coronavirus crisis and could save thousands of lives.
Myself, Dr. Samira, GP, and Sheikh Abdulkarim, we look at some of the myths surrounding COVID-19 and the vaccine. So, Dr. Samira, what do you say to the myth that the vaccines were approved too quickly to be safe?
It is important to note that these COVID-19 vaccines have been subjected to the same strict tests and processes as other medicines. The Medicines and Healthcare Products Regulatory Agency, the MHRA, which is the independent body that approves all medicines used in the UK, has assessed the safety of these vaccines and continues to monitor them. So far, millions of people in the UK have received these vaccines and no significant side effects have been reported.
There are even rumors being spread that the vaccines can modify our DNA. Dr. Samira.
This has nothing to do with your DNA and will not modify your genes. Rather, these vaccines will trigger an immune response that helps produce proteins that will later fight the virus.
Sheikh Abdulkarim, many in the Muslim community are worried about whether the vaccines are haram because of the myths surrounding about the ingredients and especially about pork products, alcohol, and fetal cells. Can you shed some light on these concerns, please?
From my knowledge, the 3 COVID-19 vaccines currently approved in UK contains no pork products or any other materials derived from animals. The Oxford AstraZeneca vaccine contains some ethanol, but the amount is considered to be so small that many Muslim scholars have said it is permissible.
Based on research, there are no aborted fetal cells or tissues in any of the COVID-19 vaccines. In fact, there are no living organisms or human cells in any of these vaccines.
Muslim leaders and organizations, including the British Islamic Medical Association, are supportive of the COVID-19 vaccines and are working hard to ensure their communities get the jab so that they can be protected. Masjids around the country are also being used as vaccination centers to support vaccine rollout.
There have been some harmful myths circulating that claim that COVID-19 vaccines can make you infertile and are unsafe for pregnant women, as there were no pregnant women in the trials.
It is best practice for pregnant women to be excluded from clinical trials of new medicines and vaccines. This is a precautionary measure, not because there are any proven risks. Because COVID-19 has not been tested on pregnant women, they are not routinely being offered this vaccination. However, there is no evidence to suggest that there are extra risks to your unborn child and yourself if you are pregnant. Pregnant women who have underlying health conditions or are frontline healthcare workers may wish to take the jab because of the extra risks they face. As a GP, I can understand how some of these claims can cause concern. However, there is no evidence to suggest that these vaccines can cause infertility in men or in women. Vaccines cause the production of spike protein, which help you build an immune response against coronavirus. One theory suggests that the spike protein can lead to fertility problems. This theory is not supported by any evidence. Most people who contract COVID-19 will develop antibodies to the spike protein. However, there has been no evidence of fertility problems in people who have previously contracted COVID-19.
I know there's been a lot of worry around the vaccine. It is important that you seek advice from your doctors and avoid false information that is spreading on social media. Any misleading information is designed to damage our community's health. From what I've researched, the vaccine has met with the UK's strict safety and quality standards and do not contain anything haram. Please ensure you book your vaccine online or with your local GP. It is also important to follow public health rules to keep ourselves, our families, and the NHS safe.